To help us better understand Alzheimer's is Dr. Frida Lewis Hall, Chief Medical Officer of Pfizer. Welcome back to the show.
Thank you. Always great to be back. Always great to be back. I know myself and my family have been affected by Alzheimer's, as I'm sure that many people in the audience and at home have. And Alzheimer's is a very difficult disease, even to diagnose. Those microscopic changes that you talked about a little bit earlier happen long before any of the signs and symptoms.
Then there are 6 key symptoms that doctors will look out for that you should think about. Memory loss that starts to disrupt daily life. Challenges in planning or solving simple problems. Difficulty completing tasks that are typically very familiar. You can be confused when it comes to time and place. And then, of course, unexpected changes in someone's mood and personality that you can't explain. And of course, after that, withdrawal. Withdrawing from friends, withdrawal from social activities, work relationships, because that person no longer knows how to function normally in those settings.
That's exactly right. And some doctors will use a simple test just to see if someone may be suffering from Alzheimer's. It's called the clock test. And essentially what will happen is a person will be asked to draw the face of a clock and to put the numbers on in their proper places, and then to add the hands of the clock to a designated time. Now, these first 2 are actually the kind of clock faces that you may see from people who have normal, varying kinds of aging. The second 2 are the kinds of drawings that you may see from someone who is affected with Alzheimer's.
And that's because common errors that people with Alzheimer's disease will make, they include counterclockwise numbering, there's absence of numbers, and the spatial arrangements can just be off a little bit. And then also, if you notice your loved one is showing any of these warning signs, or maybe even you'll see these in yourself, you don't want to ignore them, because the sooner you can get the diagnosis with your doctor, the sooner you can start taking steps.
That's exactly right. A lot of people avoid the diagnosis of Alzheimer's because of the stigma that's associated with it. But an early diagnosis allows you to have everyone involved in making those key decisions, the medical decisions, the financial decisions, and the personal decisions. And the information also allows you to be ready for things like behavioral changes. How are you going to manage that? Home safety, how will you ensure that? What are the resources, the support, and the facilities that are in your neighborhood that you may be able to draw on to get the help that you need when the time comes? And the other important issue is, we talked about how hard it is to diagnose Alzheimer's. There are things that mimic it, things like depression, things like poor nutrition, and things like drug interactions. These are things that you need to have checked out.
But when it does come to Alzheimer's, another finding shows that in the end, it's not just the patients. It can seriously, and of course does impact all of the healthcare providers who are involved. As a caregiver, you have to understand, twice as likely to experience heart disease, diabetes, arthritis. And so caregivers, they have a whole new task in front of them, and they can't ignore their own health.
That's exactly right. And it's really challenging because this is a very isolating disease for the person who has it and for the people who care for them. So it's especially important for people who are caregivers to really make their own health a priority. And if people want more information, they can come on to healthierworld.net.
And you can also visit thedoctorstv.com for more information on Alzheimer's. Thank you so much.
Thank you. It's always a pleasure.